Hello everyone, I am Dr. Satish Babu, Senior Consultant ENT Head and Neck Surgeon working in Bangalore. The three main or common symptoms in allergy is that the person will have sneezing triggered by the nasal irritation, nose blocks triggered by the congestion, tissue swelling up, and the same inflammatory process will also trigger a lot of secretion which will lead to nasal discharge. So, sneezing, running nose and blocked nose are the three cardinal symptoms of allergy. Once you have identified that you have seasonal allergies, you can be prepared, right? Simple things. Seasonal allergy means your system is allergic to the dust that is there in the air, pollution that is there in the air during that particular season. With every season change, the type of dust, the type of pollution changes. The pollens change, the flowering plants which give out pollens, that also different flowers bloom in different season. So, pollens are the most common ones which will trigger seasonal allergy. That means you can reduce the exposure if you are aware of the season. So, whichever season you are allergic to, you can reduce the exposure. Probably try to move away from those gardens where the particular type of flowers are blooming. Now, the second thing is that having steam is a very useful thing. It helps in decongesting. Very simple, you can do at home as often as you feel like. You can add some essential oils or eucalyptus or menthol, anything like that if you want. Otherwise, you can do just simple steam. That will nicely decongest your nose at least temporarily, and the nostrils will open, the allergy symptoms will be lesser. You can hydrate yourself very well, very important. I need about 4 liters of liquids on an average every day. Half of it is water and the other half can be thicker liquids, right? When you hydrate, the allergic inflammatory changes reduce. So, maintain your water content in the body very much. Blowing the nose or snorting, removing the mucus and spitting is not helpful. Do not try. Your nose block is caused by the tissues being congested and the nostrils will get blocked because of that, not because mucus is sitting there. So, blowing over an inflamed swollen tissue will only hurt them, and eventually you will start seeing some blood. It will become more painful also. So, obviously it leads to more trouble. So, no blowing, no snorting, no spitting out the mucus, right? Breathing exercises are very useful. You can do regular breathing exercises. There are a lot of help in the net, and you can go to some yoga person who can teach you some breathing exercises. You can do any one of them regularly. That also helps in bringing down the allergic symptoms, congestion and so. Nasal wash or Jal Neti also are very useful, right? So, you can try out. If you are used to doing Jal Neti, there is nothing like it, you can do it. Typically at the end of the day when you come back from outside, you are obviously exposed to so much of dust through the day. When you come back home, like how you have a bath or have a wash of the face, you can also clear the nostrils, and that will reduce the inflammatory changes eventually, right? And when you keep doing Jal Neti or nasal wash regularly, the skin also becomes a little less sensitive, and hence the symptoms will be lesser. So, these things can help to reduce the impact of seasonal allergy. Along with that, if you feel there is still some more congestion or some more symptoms are left, you can definitely go for a very low dose anti-allergic medication. I would strongly urge against using drops commercially available, freely available over the counter, but if you keep using them, you are going to end up with a lot of side effects. So, avoid those, go for more natural remedies or anti-allergic tablets and so on. Yes, allergies are the most common cause for both of these conditions, simply because allergy triggers an inflammatory response in the nose, and each person's body responds in a different way. So, there are people who will end up with a lot of congestion, sinus block and sinusitis henceforth, and there are people, a minor group of people who will be reacting in a different way, and then their inflammatory response leads to extra growths coming out from the sinuses. So, polyps and sinusitis are possibilities if you don't get the allergy under control. If you neglect it, you may end up with one of these things. There are different medications available administered by different modalities. There are nasal drops, there are tablets, there are nasal sprays, and there are other little more complicated medications. Right. Now, using nasal drops is a strict no on a regular basis. And on an odd day, when the nose is completely choked very acutely, you are not able to sleep, then maybe one odd nasal drop could help. But don't get addicted to it, don't keep using them on a regular basis, because they do work wonders by opening up the nostril instantly. And they do work, especially in the beginning, they do work for 8 to 10 hours, nicely keeping the nose open. But that should not become a routine. If you keep using them, you will end up with side effects. So, nose drops are a strict no on a long term. Tablets, on the other hand, they are safe. Most of the anti-allergic tablets are safer. You have now second, third generation of anti-allergic tablets coming in, which are safer even on a long term usage, right. There are people with chronic skin allergies who will use these anti-allergic tablets for months together, especially during the allergic season, and they are still fine. So, those are tested for long term usage with a much higher dose. So, tablets can be used, right. The only downside of that is that if you are using a tablet, it goes to the stomach, gets absorbed, and it circulates in your entire body, and while it reaches the nose, it is going to give you the relief, which means you are going to use a lot more of a dose than what is required to work only in the nostrils. You have nasal sprays which are mostly based on steroid medications, but the quantity is bare minimum, it is in micrograms. So, typically a common nasal spray will deliver about 25 to 27 micrograms of medicine per pump, which means that much only, like a few molecules of drug will go into the nostril locally where the reaction is happening. So, you are treating the allergy locally where the medication dosage can be reduced. It is simply like applying a cream on a rash, right. If there is a little bit of cream applied on the skin, be it steroid or otherwise, how much of active chemical is there in that? The same principle is applied here. Allergy is a rash in the nose. So, you are treating it with medication locally, but you cannot apply a cream into the nostril effectively. So, that is why the spray format. Even if it is steroid based, it is very safe. You can use it for long term. There are people with allergies, very bad allergies, who kind of keep it on through their life. I am talking about 10 years, 15 years, 20 years of consistent usage, right. If they have allergies, they have it. They do not have to go through the pain of symptoms. So, use the medications, nasal sprays as prescribed by the doctor, and they are safe. It is so safe, we end up giving it even in pregnant women and feeding mothers if the need arises. Judiciously, but definitely you can use the nasal sprays on long term. Nasal wash with or without medications also can be used as a routine. Like I was saying, Jal Neti or saline nasal washes are also helping in a chronic allergic situation. Other treatment modalities are available. Immune modulation therapy is there. You can have steroid injections given to you during the or just prior to the season where you know you are going to have a lot of symptoms. You can have a long acting steroid injection given, and that will tide over the season for you, right. And those kind of things can be used, but in my opinion the safest will be nasal sprays, consistent usage, and followed by anti-allergic tablets.